This tutorial is a presentation of data from the California Healthy Kids Survey. It examines the responses to health-related questions of middle school and high school students in San Luis Obispo County who identify as lesbian, gay, bisexual, or transgender. It looks at the disparity in responses and gives us a look into their mental health status. The data presented here has been sponsored by a consortium of these local agencies over the past 7 years. The California Healthy Kids Survey is a statewide confidential survey of school climate and safety, student wellness, and youth resilience. Since 1997, this survey has assessed health risk factors in public school students. In 2013, the California Healthy Kids Survey added questions asking students to indicate whether they identify as straight, gay, lesbian, or bisexual, and whether they identify as male, female, or transgender. These additional questions have allowed for an in-depth look into health-related risk factors for LGBT-identified students. San Luis Obispo was the first county in the state to analyze the data in a way that revealed a clear profile of our students. In 2019, the California Healthy Kids Survey was administered to 1,100,000 middle school and high school students in California. That is about 1 in every 3 students. This means that the data being presented here is accurate to within a fraction of a percentage point and is highly reliable. I want to say a few words about terms and acronyms. I will be using the acronym LGBT, which refers to middle school and high school students who identify as lesbian, gay, bisexual, or transgender in San Luis Obispo County. The data for these two groups will be treated separately, but often you will hear the entire acronym. Because of how the questions were asked on the survey, the term transgender may be inclusive of youth who also identify as queer or non-binary, which means that they don't relate to either male or female identities. Accompanying this presentation, you will find 2 fact sheets that describe disparities in 54 mental health risk factors. Note that in the California Healthy Kids Survey, several hundred risk factors are surveyed. What is presented here is just a sampling from the overall survey. The fact sheets show the data beginning in 2013 and then compare those findings with data from 2015, 17, and 2019 to show trends. You will also find the 2019 data for San Luis Obispo compared with all of California, so as to get a sense of how our county compares with the rest of the state. There is one fact sheet for students identifying as LGB and one for students identifying as transgender. Enrollment in middle school and high school in San Luis Obispo County school districts in 2019 was at 16,483. Data for the California Healthy Kids Survey presented here then is drawn from responses from 8,008 students. These were 7th, 9th, and 11th graders. This number, 8,008, is approximately 50% of all middle school and high school students enrolled in that year. And because of that, we can have some confidence that the data we're presenting here is extremely reliable. You might be wondering just how many students in San Luis Obispo identify as LGB or transgender. Is it a large number or a small number? Youth identifying as LGB was 7% of the total middle school and high school population, which, based on enrollment, would be 1,153 students in 2019. By comparison, in California for the same year, 7.2% of students identified as LGB, which represents 204,116 middle school and high school students. Youth identifying as transgender was at 1.3, which would represent 214 middle school and high school students in San Luis Obispo County. Of course, these represent public school students, so if we included private school students, the numbers would be larger. In California, 1.1% of the enrollment means that 32,075 students identified as transgender in 2019 in California. Here, the county-level data are broken down by the 4 large school districts in the county. Based on enrollment figures for the districts, these are the approximate numbers of students we would expect to see. In Lucia-Mar School District, LGB at 351, transgender 65 students. In San Luis Coastal, we would expect to see 259 LGB identified middle school and high school students and 48 transgender. In Paso Robles, LGB would be at 237, transgender at 44. And in Atascadero, LGB would be 156, transgender at 29. Let's first look at a few of the responses related to school attendance for LGB youth in San Luis Obispo County. When asked, did you skip school or cut class more than once a week in the past 12 months, 2.7 of the general school population answered yes, whereas 4.6 of the LGB students said yes. This is almost twice the percentage. When asked, did you miss school because you didn't feel safe at school in the past 30 days, 1.7% of the students in the general population said yes, but 5.5% of the LGB students said yes. This is more than 3 times the rate. Here we see the responses to the same questions by transgender youth. You will notice that instead of the 4.6% and 5.5% responses in LGB youth, the responses from transgender youth to these same questions show an even more dramatic disparity. Instead of 2 or 3 times more likely to have missed school or not feel safe at school, transgender youth are 6 times and 7 times more likely. This finding, that the response of transgender youth show a much higher level of risk, will be true for almost all of the risk factors we will describe, pointing to the fact that this population is generally at even greater risk of health disparities. Here are 3 risk factors that relate to bullying and harassment. When asked, have you been pushed, shoved, slapped, hit, kicked by someone 1 or more times in the past year, 21.6 of the non-LGB students admitted to this, whereas 32.9% of LGB students did. When asked, have you been afraid of being beaten up in the past year, the disparity was 13.1% in the general population, but 31% for LGB students. When asked, were you harassed or bullied because you are gay or lesbian or someone thought you were, 6.3% of the general population responded yes, but 49.8% of LGB students responded yes. This is 8 times the number. And if you look at this in terms of overall numbers, this would be 575 LGB students who were bullied or harassed each year because they were gay or lesbian or someone thought they were. Let's look at responses to the same questions from transgender youth. When asked, have you been pushed, shoved, slapped, hit, kicked by someone 1 or more times in the past year, 22.1% of the general population of students admitted to this, whereas 49% of the transgender students did. When asked, have you been afraid of being beaten up in the past year, the disparity was 14% in the general population, but 47.5% for transgender students. When asked, were you harassed or bullied because you are gay or lesbian or someone thought you were, 6.3% of the general population responded yes, but 49.8% of the transgender students responded yes. This figure is identical to LGBT students. Another area of risk is substance use. The California Healthy Kids Survey asks about 50 questions related to substance use, and LGBT students show higher rates on all 50 of the questions. Here are just a few examples. Lifetime use means that the person has used that substance at least one time in their life. For alcohol, 27% of the general population admitted to using, as opposed to 42.9% for LGBT students. For marijuana, 21.2% of the general population versus 36.2% for LGBT students. For meth and cocaine, the disparity was 5.6% in the general population versus 14% for LGBT students. Here you can see that in all of the categories of drug use, transgender youth were elevated even higher, especially for use of meth and cocaine. The data show them elevated by 5 times the rate of the general population. I would point out that use of meth and cocaine at this age, in middle school and high school, is highly predictive of later substance use issues. So these figures predict future issues with drugs for the LGBT students overall. In the area of mental health, we see some disturbing indicators of risk in our LGBT middle school and high school students. When asked, did you ever feel so sad or hopeless almost every day for 2 weeks or more that you stopped doing some unusual activities in the past 12 months, 29.8% of the general population admitted that they did, whereas 69.8% of the LGBT population did. This is about 800 LGBT students in San Luis Obispo County each year. When asked, did you ever seriously consider attempting suicide in the past 12 months, 15.8% of the general population answered yes, compared to literally 50% of LGBT students. Here we see similar numbers, only once again we see that transgender youth are even more elevated in terms of contemplating suicide, with 60.5% admitting to that. I will note that in California as a whole, the rate for transgender students contemplating suicide was at 52.7%, meaning that in San Luis Obispo County, our transgender youth show a higher rate of contemplating suicide by 8 percentage points. These two slides mean that identifying as LGBT is, in and of itself, a serious risk factor for suicide. Now we will explore a few of the protective factors from the survey data. Protective factors are those things that should help our LGBT students feel more connected to school, more valued and appreciated, and thus hopefully this would reduce overall risk disparities. When asked, do you feel close to people in this school, 13.2% of the general population said that they did not feel close to people, whereas 23.3% of LGBT students said that they did not. When asked, are you happy to be at this school, 16.4% of non-LGBT students said no, in comparison with 28.7% of LGBT students. When asked, do you feel like you are a part of this school, 17.4% of the general population said they did not, compared to 32.3% of LGBT students. Here we see the responses of transgender students to the same questions. Here, rather than 23%, 31.7% said that they did not feel close to people at the school. 46.1% said that they were not happy to be at the school, and 45.6% said that they did not feel like they were a part of the school. Here are two more protective factors. When asked if they felt safe at school, 13.2% of the general population answered that they did not feel safe, and 22.3% of LGBT students said the same. When asked if teachers at this school treat students fairly, we see that 15.6% of the population said no compared to 20.1% of LGBT students. Here you see the responses of transgender students to the same questions. 40.7% did not feel safe at school, and 36.9% said that teachers did not treat students fairly. What I have shown here is a sample of 15 risk factors for LGBT youth. In the fact sheet attached that I referenced earlier, 54 risk factors were explored. How many of those risk factors would you imagine that LGBT youth were elevated on? Well, if you guessed 100%, you would be correct. Our LGBT and transgender identified youth in San Luis Obispo County were elevated in all 54 health indicators. This is consistent with data in California as a whole and in every one of the 58 counties in California. We have looked at a few of the sample risk factors in isolation. Here you can get a wider view of some of the disparity between risk factors. The blue bars on the left are responses from LGBT or transgender students, and the red bars on the right are from the general population. So here you can visually see the tremendous disparity between the two groups. It is important to note that the mental health disparity between the groups is not due to some inherent quality, as though being LGBT or transgender also naturally inclines one toward being bullied, depressed, suicidal, or of a weaker character, or more likely to use drugs. The source of the disparity is in not being accepted or included, of being made to feel different or less than others, of not feeling like they belong in the same way that everyone else does. These same risk factors would be true of any group that was marginalized, and they show the devastating impacts on people who do not feel like they belong or fit in or are made to feel less than. It is also important to note that with full acceptance and inclusion, these risk factors would disappear. What I have shared is the sad truth of the status of youth in our San Luis Obispo County. These are our neighbors, the children of our neighbors and friends, our community members. They deserve our attention and support. So, what can I do, you might ask? Well, you can certainly support your local school district's efforts to support our LGBT and transgender identified youth. Reach out to any LGBT youth whom you may know and find ways to support them and connect with them. Support campus clubs such as a Gay-Straight Alliance. Know your district policies and advocate for safety and equality. And finally, become an ally for all youth. For more information about the California Healthy Kids Survey or the fact sheets, you can reach me at john.elfers@sophia.edu. Thank you for listening.